Cervical smear or the pap smear. Whenever you go to the gynecologist, she asks you, did you do the pap smear or the cervical smear? And you're all question mark what this thing is. Let me tell you what is the pap smear or the cervical smear. This is the model of the womb along with the tubes and ovaries and the vagina. So see this womb, at the end of the womb, there is a neck of the womb. There are some cells which might be growing down there. They're not necessarily cancer cells, but they might be cells marching down to be cancers. And maybe within 2 years, 5 years, or 10 years, they may become cancer cells. Science here has achieved success in preventing cervical cancer. And how we do it? We do it by detecting precancerous disease much earlier, and we can treat it and protect women from cervical cancer, which is the disease of young age. So how do we do that? Say suppose this is a uterus and this is a vagina. We use a speculum, no need to be scared of that because only this front few centimeters enter in the vagina and it goes in, and we just with slight open, and then it's a very soft brush. If you see, I'm rubbing it on my skin. It's very soft and bendable. That brush goes in and it rotates to collect the cells. And that cells are then introduced into the water, which is a special water, and then after closing, it goes to the lab. In the lab, to have a closer look, they put it in a slide and they see it under microscope to see whether your cells are going in the wrong path to be cancer. And then there are treatments available which can protect and prevent cancer from happening. Now, number one question, who should do it? This test should be offered to the women from age of 25 till the age of 65. But in some part of the world, it is being offered at the age of 21. So why there's a difference between 21 and 25 years? I personally offer women from the age of 25 to have the cervical smear. And why? What is the difference? When in some part of the world it is being offered at the age of 21, their rationale is that do not offer treatment. So if I tell some women that you have abnormality in cervical smear, but by recommendation I'm not going to offer you treatment, it will be hard fact to sleep on. While other parts of the world which offer the test at the age of 25 years, they say it's no need to offer test before 25 because these people are young and they have ability to remove the disease or get rid of disease by their immune system. So no need to offer treatment and no need to offer even the test. Pap smear is done every 3 yearly till the age of 49 and then every 5 yearly till the age of 65. If your final test at the age of 65 is normal, no further testing is offered or required. When you're done with the pap smear, don't forget that you have to come back for the follow-up of the result. Ask your doctor who has done the pap smear how to follow the result, and they will tell you whether it's by telephone or they may collect the report, they might be receiving the report, but still you have to confirm the normalcy of report. It's ideal that you keep a record of this report because then you will know what was the report previously and you can show that report after 3 years to your doctor, or even if you're moving or to a new doctor, what was the report, and even you will know exact time of doing the testing by having the date written on your previous test. Abnormal uterine bleeding. A lot of women have questioned whether their change in the pattern in the bleeding is abnormal or not. So before you go to the doctor, it's ideal to go to the doctor, but let's have a chat about it. So if your cycle is less than 21 days or more than 35 days, it is abnormal. If your variation between the cycles is more than 5 days, it is abnormal. If you perceive that your flow has become heavier, this is abnormal. And if you perceive that your flow has decreased, it is abnormal. Or if you are postmenopausal and you bleed after a year of menopause, it is absolutely abnormal. Or if somebody has other pattern of the bleeding, which is inter-period bleeding for any reason, they are also abnormal. So you must go to the doctor for evaluation, because examination is a must in such a case. So when you go to the doctor, how doctor will evaluate your bleeding? Doctor may do speculum exam, which is a topical exam, and they may do ultrasound. Ultrasound can tell a lot of things and the reason of bleeding, but still it's not the gold standard. The gold standard for abnormal uterine bleeding is hysteroscopy. So what is hysteroscopy? Hysteroscopy is a modern day DNC in which you use a special tube-like instrument, which is a telescopic device, and it is fitted with the camera. It is introduced through the cervix into the uterine cavity, where it is filled with the sterile water, and which makes it balloted or ballooned up where your camera can work. And then that camera transmits the picture into a big screen in the operation theater, where your doctor cannot just see the disease, but immediately they can treat the disease. Most of the people take general anesthesia for this procedure, but some brave women opt to have spinal anesthesia. So if you have taken spinal anesthesia for this procedure, then you may be witnessing or seeing the disease yourself in the operation theater. Why we do the hysteroscopy? Hysteroscopy is done for the reason of abnormal uterine bleeding on the top, people who are trying to become pregnant, they can't be pregnant, or if they have recurrent miscarriages, or if they have polyps. Polyps are soft growths hanging from the roof of the uterus, and they can interfere with the bleeding pattern. Or the fibroids. Fibroids are muscle knots. Sometimes they do protrude into the cavity. Sometimes it is also done to keep coil or to remove coil if the thread has been lost, or if coil has penetrated into the uterine cavity muscle. What are the requirements of doing the hysteroscopy? Yes, the month you're planned for hysteroscopy, you should not be pregnant, but it's better to avoid any hormonal contraception, because they can interfere with the test which your doctor is about to do from your uterine cavity. So it's better to use barrier contraception up until the day you have the procedure. Even on the day of procedure, your doctor may perform pregnancy test. If you're pregnant, doctor may not perform your hysteroscopy. Ideally, it should not be performed on the day of periods, because with the periods, your vision of uterine cavity will be obscure. So it's better there should not be any bleeding. With the heavy bleeding, of course, the hysteroscopy cannot be performed, but if you have mild bleeding, it may be performed or it may not be performed. Ideally, you should call your doctor and tell them if you have mild bleeding, and if the procedure can be performed with the mild bleeding. On the day of surgery, you come to the hospital with no food, 8 to 6 hours, depends on your anesthetist requirement. And it's a day case normally. You get admitted maybe 2 3 hours before the procedure. And after you finish the procedure, you come out of anesthesia, you start eating, you start walking, then you are discharged from the hospital. If you are on regular meds for your diabetes, hypertension, or any disease, you may take those medication with a sip of water, and you should avoid smoking at least for 24 hours for better healing. Immediately after hysteroscopy, what we expect, normally hysteroscopy takes only 10 to 15 minutes, and it may take longer depending on the procedure. And then you will come out of anesthesia, you will be kept in recovery place, and in recovery place, once you get better, you'll be shifted to your regular room, where you will mobilize, you will start taking food, and once you will start feeling completely normal, you will be discharged with some medication, which could be analgesics and antibiotic depending on your doctor. And you will be instructed not to drive on the same day, and it's better to bring a companion or somebody to take you to home and take care of you for the same day. Next day, you can resume most of your activities. You will be given appointment maybe after a week or 10 days, depending when your histopathology is available. When you will come back for your follow-up appointment, you'll be having discussion with the doctor. They will do explanation with the histopathology, and they will explain to you what disease is there and what should be the further plan, because your further plan depends on what was diagnosis on the closer look of your endometrium. What are expectations just after hysteroscopy? You might feel dizzy because of anesthesia, which should get better next day. You will expect some vaginal bleeding for a week, and it should not be heavy. If it's heavy, you must contact your doctor urgently. You may expect also some vaginal discharge, which should be normal, but if it become offensive or bad smelling, then you must contact your doctor urgently. Going back to work, it depends what anesthesia you have, how long was the procedure, and what was the procedure. As soon as you start feeling normal, you can go back to the work. After surgery, once you start tolerating food, you can take the food, and after that, there's no restriction on the type of food. Same day, you can take shower, but avoid bath till next day. When you should contact hospital urgently? If you have heavy bleeding, if you have offensive or bad smelling vaginal discharge, or if you feel pain, then you should urgently contact your doctor. Ovarian cyst. This is some topic every woman should know some details about it. Why? Because when you go to the doctor, gynecologist, they perform your exam, and the moment they take out the word cyst, women panics. Let me tell you what the cyst is and what ovarian cyst is. Cyst means just fluid-filled cavity. And you as a woman, every month, make a cyst, which is follicle or egg, till 2.5 centimeter or 25 millimeter. This is called egg. But once it exceeds this size, doctor calls it cyst. But even till 50 mm or 5 centimeter, it's not very concerning, especially if it is filled with water only. Since your body is not reading books, sometimes this egg exceeds in size and it can become retained and it can be called cyst. But you don't have to panic, especially if it is filled with the water. All you have to do is to follow up your doctor to know whether it's disappearing or not. But this should not be taken very lightly if it is more than 50 mm or 5 centimeter, because they can twist, they can tort, they can remove the blood supply to the ovary. In that case, it's an urgent situation and you should be in the hospital to get it corrected before your ovarian cells become dead. Most of the time, women makes cysts which are called functional cyst. They make egg, that egg is called follicular cyst. It is supposed to ovulate or get exit from the ovary, but sometimes it doesn't do that. And it stays and it keep on increasing the size. Then we call it follicular cyst or functional cyst. And sometimes they bleed inside, and this is called hemorrhagic cyst. Hemorrhagic cyst is also a type of functional cyst, but just one added thing is bleed happens inside of this cyst. For both the cases, all your doctor has to do watchful waiting. What does it mean? They might perform an other ultrasound once your cycle is over, or maybe after a month. Most of those cysts, they do disappear, but if they don't, doctor may advise you some further plan. Hemorrhagic cyst, what we have to do about that? Hemorrhagic cysts are again functional cyst, simple cyst with the water filled inside, except an added detail that there is a bleed inside. Body has certain mechanism. Whenever you have a bleed anywhere or some blood collection, your white cell come forward and they eat all those blood cells and they make it clear. Same way, your white cells come forward and they clear those blood cells, and hemorrhagic cysts disappear by just watchful waiting. But sometimes it may cause pain, and because of their size, they may tort. That is an emergency, and in that case, your doctor would like to perform laparoscopic surgery, which is a keyhole surgery to remove that cyst. Cysts are normally diagnosed by ultrasound. Ultrasound has the whole criteria to classify bad cyst or the good cyst. Most of the cysts in the world are good cysts. If your doctor finds something suspicious in the cyst, they might order MRI to see the further details of your cyst. And sometimes doctor do perform an additional blood test, which is called CA-125, which tells further details of the cyst, and it can help doctor to classify cyst as a bad one or the good one. There's another type of cyst which is called endometrioma or endometriotic cyst or the chocolate cyst. There is a different kind of management for that. More than 3 centimeter is being encouraged to have removed by surgery, which is laparoscopy or keyhole surgery. Less than 3 centimeter can just be observed. If you have ovarian cyst, or if you have pain, or if you have irregular bleeding or heaviness, you should consult the doctor, because maybe you are harboring an ovarian cyst. If that cyst size is more than 50 mm or more than 5 centimeter, you might be at risk of ovarian torsion or the twisting of the cyst. When this happens, your ovary doesn't get the blood supply and it can become dead in some time. So you should consult your doctor in case of any irregular bleeding or pain, heaviness, or even feeling like vomiting, because maybe you're harboring ovarian cyst. And there's another kind of emergency in which ovarian cyst rupture into the cavity, and in that case also you need to have an urgent surgery. Let's do some myth busting for the ovarian cyst. There's a myth that ovarian cyst cannot be prevented. Let me tell you, ovarian cyst can be prevented, but prevention is not for everyone. If you are a habitual ovarian cyst maker, you should discuss it with your doctor. They can prescribe you some medication, which is hormones, And those hormones will prevent you from the beginning of the cycle not to have cyst. So you can be on a plan rather if you are the one especially who end up having surgery for the ovarian cyst. There's a myth that ovarian cyst requires surgery. No, it's not always the case. Ovarian cyst requires surgery if it's not functional, if it's more than 50 mm or 5 centimeter, or if you have pain which could be due to ovarian torsion or twisting, or if your cyst has rupture. But last not the least, if your doctor suspects some bad disease of tumor condition which could be potentially cancerous, they also advise you to have surgery. But that cyst is very rare in the world, so most of the cysts are resolved by just watchful waiting. There's a myth ovarian cyst causes infertility. Let me debunk this myth by telling you that all the women make ovarian cyst, which is egg, and the ideal size of that cyst or follicle is 18 to 22 mm, but your body is not reading the books, so sometimes it exceeds this size and it become more than 25 mm, then same egg is called cyst. And sometimes it forget to get released from the ovary and it is called retained follicle or the functional cyst. But it is not related to subfertility. But if you are making those follicles every month, then you are very fertile by definition. There's a myth all ovarian cysts are cancerous. So let me tell you that most of the cysts which happen, they are benign. They don't cause problem. It is very rare to have a cyst which might be potentially cancerous, where we do the surgery, and after surgery which we perform for the women who might be having potentially cancerous cyst, most of the histopathology, which is a closer look to the cyst, results comes benign. If you have any signs or symptoms which could be potentially pointing to the ovarian cyst, like irregular bleeding, pain in the pelvis of any kind, heaviness, feeling like nausea, then you must consult your doctor and get yourself evaluated if you have cyst or not. Even if you have cyst, there's a good thing. They are mostly benign or functional and they get resolved on their own. Very, very rarely, those cysts may cause emergencies like torsion or twisting and rupture. And much more rarely, those cysts could be potentially cancerous, but this situation is very, very rare. Stay informed, stay healthy.